Hello, I am Dr. Sai Sudarshan, Director Neurosciences, Pulse Superspeciality Hospital, Ranchi. Today I am going to give a brief talk about stroke, which is one of the commonest presentations a neuroscientist sees in his practice. It's a silent killer. Stroke is a silent killer. What I call one of the common causes of death in the human mankind's history, and the commonest cause of chronic disability. Anybody who has a stroke, who survives, is dependent on his life till he dies. The statistics are even more bad. Every 6 seconds, one person in the world is dying with stroke, and the stroke attacks every one person a second. So it is called as brain attack in common man's language, akin to heart attack. Brain is one of the most active organs in the body, and it consumes 20% of oxygen. That is the dependence of on oxygen by the brain. Why this stroke occurs? There are many risk factors for this stroke. One is high blood pressure. Second is irregular heartbeats. Third is diabetes. Fourth is obesity. And lifestyle situations like chronic smoking, alcoholism, and drug abuse. You are seeing strokes in young these days. That is all because of the drug abuse. Now let us see what is the stroke. Stroke is an acute symptom, is an insult on the brain which results in a neurological deficit. By neurological deficit, I mean that sudden loss of speech, sudden blindness, or not able to see properly, one side weakness, not able to move. That is what is called as lakwa, paralysis. So these are all the common symptoms of stroke. Stroke is of two types. One is a hemorrhagic stroke where there is bleeding in the brain tissue. Second one is ischemic stroke where there is no blood circulation to the brain. So you can always equate it like the first one is like floods where more water is in the field. The second one is drought where there is no water at all. If these changes can be made, the stroke incidence can definitely be brought down. Now, what we can do if a patient comes with a stroke? Now, if the patient comes with a stroke, we divide it into whether he has reached within 4 hours or 4 hours have passed. Supposing he reaches within 4 hours, we immediately have to do a CT scan and to rule out a bleed in the brain tissue. If there is no bleed, one can start a medicine called clot buster. It is given through a peripheral vein. It is given through a vein here. It is called as tissue thromboplastin, IVTPA, and that is supposed to lyse the clot within the blood vessel. To increase the awareness of how fast you should reach a tertiary center, there are certain symptoms called FAST. Supposing there is a deviation in the face, aisa hoga, or if there is a slurring of speech, if the speech is not normal, like that, and if there is weakness of the arm is weak, movement nahi ho raha hai, upar nahi le raha hai, upar. So that is a time to rush to the hospital. So FAST, be fast. Trying to rush to the hospital. People should not waste any time to reach the hospital. If they reach in proper time to the hospital with the facility of these things, strokes can be cured. It is not prevented, cured also. But the first thing is you have to prevent it by changing your lifestyle problems like heavy smoking, chronic alcoholism, and getting your blood pressure and diabetes under control. Thank you.